Hello everyone, I'm Dr. Michael Brown and I'd like to welcome you to onstageRx.com, your source for patient video education. Today we're going to talk to you about epinephrine autoinjectors. Because these devices are used in life-threatening situations, it's important that you and those around you receive the appropriate training. Epinephrine autoinjectors should be used by anyone who has ever experienced anaphylaxis. Now, what is anaphylaxis? Well, it's an emergent allergic reaction to certain types of allergens. It usually occurs in seconds to minutes after you are exposed. Most commonly, these reactions involve the skin or the respiratory tract or lungs. These symptoms can include things such as skin reactions of flushing or hives, low blood pressure or hypotension, tightening of your airways, and a swollen tongue or throat. You can also experience a weak or a very fast pulse, nausea, vomiting, or diarrhea, lightheadedness and dizziness, or fainting. Anaphylaxis is unpredictable. A mild reaction one time might cause a very serious reaction the next time. What types of things cause anaphylaxis? Certain foods, insects, medications, latex, and even exercise. Now, how do I know when I should use my epinephrine autoinjector? Well, it turns out that this is a very complex question, and there's no consensus from one professional medical group to the other. Some people believe in using an injector at the beginning of very mild symptoms, and others only when more severe symptoms occur. Because of this, I recommend you discuss this with your primary care physician, and be sure that you understand when they expect you to use your epinephrine autoinjector, and be sure to call 911 anytime you use your injector. Generally, any adult who is experiencing symptoms of troubled breathing, feeling tightness in their throat, they're lightheaded, or think they might pass out, should use their epinephrine autoinjector. Also, in general, any child who is not responding or has food allergies or vomiting repeatedly right after eating something that we know they have allergies to, or coughing repeatedly during an allergic reaction should use their epinephrine autoinjector. Also, if a child has definitely eaten a trigger food, in this special case, it's reasonable to use the autoinjector prior to their symptoms occurring. Again, you should review this with your primary care physician. Always call 911 when you need to use your epinephrine autoinjector. If you are alone, administer the epinephrine autoinjector first and then call for help. What are the different types of epinephrine autoinjectors? Well, all of epinephrine autoinjectors come in a child 0.15 milligram and an adult 0.30 milligram dose. You should use the dose that is prescribed for you by your primary care physician, as size and weight need to be taken into consideration. Most epinephrine will be prescribed in a twin or a 2-pack. This is not so that you can have one at school and one at home. 1 out of 3 cases of anaphylaxis required an epinephrine autoinjector second dose of medication. So consider that before you separate your 2 doses in different locations. The second dose is usually given within 5 to 15 minutes of the first dose, which is sometimes before any help can arrive. The major brands of epinephrine autoinjector include Epipen and Adrenaclick. Both also have generic versions which look and work exactly like their name brand versions. Both are simple and easy to use, but there are a few differences. So how do you use your epinephrine autoinjectors? 1. You remove it from the respective case. You inspect the expiration date and the color of the fluid. It should be clear. While a new epinephrine prescription should be obtained after one expires, in general it is said that an expired epinephrine dose is better than none at all. You will, however, not be getting a full amount of the medication after the expiration date. You need to identify where you'll be giving the injection. It should be the mid to outer thigh. You want to get it in the muscle because it will work much faster than if it was given into the fat above the muscle. You do not need to remove clothing. It will go through your clothes, including jeans. You'll hold the device with a closed fist in the middle of your thumb and fingers, away from both ends. For the Epipen or its generic, remember blue to the sky, throwing the blue away, and remove that safety cap. Never touch the orange tip. Over 1,000 people a year accidentally end up injecting themselves with epinephrine, usually in the hand or a finger. It's not very pleasant. Then you need to remember orange to thigh. You'll push it into your outer thigh until you hear a click and you will hold. It's important that you hold it for several seconds. The actual time varies from device to device, but most of the medication is given in the first few seconds. I recommend slowly counting to 10. As you pull back the device for the Epipen or its generic, the needle will be safely protected in this orange tip, and you'll want to remove it. For the Adrenaclick and its generic, you'll want to remove it from its case, which is different than the EpiPen's case. Remember the same placement in the mid to outer thigh, and you are still able to administer through clothing. Again, you'll grasp the device with a closed fist, keeping away from the edges. You'll then remove both of the safety caps. Do not touch the red cap. Push the tip of the red cap into your outer thigh. Slowly count to 10. You'll then remove from your thigh, and you should see a needle with the Adrenaclick. This is because it does not have a protective device. You'll put the needle back into the carrying case by putting the carrying case on the ground or a bench and then putting it in. Do not hold the carrying case in your hand. Remember, after you use an epinephrine autoinjector, call 911. Using an epinephrine autoinjector does not replace the need to be seen right away by a physician. As always, you should review this information and questions you have with your primary care physician and have them review with you how you should use your epinephrine autoinjector. I strongly recommend you see if they have a training device such as the ones I just used in their clinic so that you can actually practice with it. Thanks again for watching our video today. If you feel this video was useful to you or your patients, please support us by subscribing on our social media links and our website onstageRx.com.